I can't overstate the importance of having that foundation, because it wasn't just getting as much data as we could get our hands on. It was being very strategic about what are the key indicators that really paint a picture of how kids and families are doing, and having consistent data so we could measure trends over time.
Hello and welcome to the Partnership Connections podcast. This podcast is centered around child welfare training and educational topics, all with the goal of helping to support those already working in or with an interest in working in child welfare. My name is Stan Brazier, and I'm the project director for the Learning Partnership between the Rhode Island Department of Children, Youth, and Families, or DCYF, and Rhode Island College. Before we begin, I'd like to note that all the views and opinions expressed by both the host and guest in this podcast are their own and do not necessarily reflect those of the college or the organization that they might represent. So without further ado, our guest today is Elizabeth Burke Bryant, professor of the practice of health services, policy, and practice at Brown University School of Public Health. She is a child advocate with over 30 years of experience in advancing equitable policies and programs to improve the well-being of children, youth, and families. And she served as the executive director of Rhode Island Kids Count, which is a children's policy and research organization from its founding in 1994 up until 2022. Elizabeth, thank you so much for joining us, and great to have you.
Thank you, Stan. Great to be on this podcast.
Yeah, thanks for taking the time. We know everyone has a super busy schedule, so we're always grateful when we have people take the time. So tell us, who are you, and what aspects of your personal journey do you feel like have led you to where you are today?
Well, it's a great question, and I am always interested in other people's journeys because they tell you a lot about where they end up. Mm-hmm. I was born and raised in Providence, Rhode Island, grew up in a family that was very civic-minded, always sort of encouraged us as kids to get involved with our community, and really had a value that public service is an honorable calling. And I always appreciated that, especially as I grew up, went to college, and realized that all kids weren't getting that message. So I had a real view of the importance of public policy from a young age. My house that I grew up in near Providence College is literally just a mile from the State House. And as I, got further along in my education, I just really wanted to concentrate on public policy as a way to improve the lives of kids and families. I went to law school, not with the idea really of practicing law, but to know that I had some of the training that you get in law school to really identify issues and really outline possible solutions. And so I'm glad I have that training. After law school, I came back to my home state of Rhode Island and was initially involved in the newly established Providence Housing Court, which was brand new at the time. And I would go out with building and housing code inspectors to properties where there were code violations. And Stan, that really opened my eyes to the way kids and families were living just about a couple of miles from where I grew up. Roaches and rodents, all kinds of faulty wiring, either too much heat, too little heat. And I got, as anyone would, concerned about these conditions. And rather than a house-by-house approach, it seemed to me that there needed to be bigger solutions, more affordable housing, ways to reach more people. After I had that experience as a lawyer in the city housing court, I just decided that it would be great to look at problems from a systemic point of view. And so Rhode Island Kids Count was started in 1994. I was the first executive director, working with a great team. And we really focused on building a child advocacy organization that had a real grounding in the best available data and making sure that we laid that credible foundation and then look to, okay, if the numbers are going in the wrong direction, what should we do to turn them around? And that really brought us into best practice research about what works to improve kids' outcomes and their families. And so Rhode Island Kids Count grew from a small team of about 3 in 1994 to a staff of 10 now. I stepped down a couple of years ago, as you noted, and Paige Parks is now the director of Rhode Island Kids Count. From the start, the organization has focused on the full range of children's issues, from education to safety to economic well-being and child welfare. So child welfare has been a core part of Rhode Island Kids Count's work. And now in my new role as a professor of the practice at the School of Public Health, I'm based at the Hassenfeld Child Health Innovation Institute, where the core focus is on family, behavioral, and mental health. And so that's a real natural extension of my work because, as you probably know, and some of the podcasts have covered, there's an increase in instances of behavioral health issues with kids. And there's a lot of issues in our system to ensure that we have the best possible access to prevention and treatment. So it's very much linked to the child welfare issue as well.
Mm-hmm. Okay. I want to get into some of that too, but take us back a little bit. Mom and Dad, public policy. You mentioned the public policy piece. What do they do?
Well, actually, my father ran for mayor of Providence when I was 6 years old.
Okay.
He did not win. I think one of the hardest things he said he had to do was to tell me that he'd lost.
Okay.
He never went on to run again, but he was always he was also a lawyer. He was involved in a lot of public policy jobs in state government, and I think that really was very much of a role model to me. Another role model is Marian Wright Edelman, who was the founder of the Children's Defense Fund in Washington, a national child advocacy organization. And she was just an inspirational role model for how do you really lift up the voices of kids and try to move the ball by public policies that work.
Mm-hmm, mm-hmm. And time spent as an attorney in the housing arena, right? Is there anything else that you would want to mention as a sort of an eye-opening thing? You said sort of the conditions that people were living in, right? But we all know the fact that rent is not getting any cheaper. It's getting higher. And fast forward all these years later, right? So what about that experience was eye-opening, and what would you maybe say to some of like the families that are out there struggling right now and some of the child welfare workers that are tasked with working with them? And I know that housing, still remains a big issue, right? So I'm wondering what kind of your thoughts are, knowing you had that sort of experience specifically in the housing arena, and this is a big issue still for a lot of families, right? Mm-hmm. So what else might have been eye-opening about that experience, and how does that sort of tie into some of the same issues that families are dealing with today?
Well, it's only gotten worse in terms of affordability, and there's been a lot of efforts to try to increase the stock of affordable housing. I know it's been a priority of the General Assembly. In particular, Speaker Sakarchi has led the way on many bills and investments, but there's still so much further to go. I think that what opened my eyes at that point was that housing is a reflection of people's lives. Where a child sleeps and lays his or her head at night is so incredibly important for whether they can get up and be ready to go to school, whether there is family tension because there's just not enough space. All of the things that you think of that really are part of a sound foundation for a family center on housing. So I think that the lack of affordable housing and child welfare are intertwined. And that's why when we look at solutions, really looking at basic human needs for families, having families have what they need to thrive, and that includes housing. In the child welfare arena, I've been impressed by the work of Foster Forward, who has had a very keen interest on young people aging out of the child welfare system. And I know that Lisa Gillette and her team had searched for years for affordable units for those young people who don't have the advantages of children and youth who have grown up in families, and they're in permanent families. So I really salute their work to say, okay, not enough housing, we'll build it. And
Right.
So they are involved with the first goal was trying to create 100 new units that these young people could use. But everyone that's involved with DCYF, I'm sure that if you were to ask caseworkers what one of the number one problems is, they would say housing, because it's the foundation of the ability to have what you need to support your kids and be able to provide a safe, comfortable environment.
Yeah, absolutely. So you mentioned your time with Kids Count. You were there for quite a while, right?
Yes.
What did you learn about the importance of data and children and family well-being advocacy work? What really rose to the top for you in terms of the importance of data?
What I learned most is that credible advocacy requires a solid foundation of data. It's not effective to be advocating for various policies and systems changes without data to back you up. So when Rhode Island Kids Count first started, the biggest job that the organization had was to make partnerships with the state agencies, including DCYF, and request data that had never really seen the light of day. There were many great people in state agencies mining data and analyzing data, but it never really got out there for use by policymakers and citizens and parents and educators. Mm-hmm. So we went from an annual Rhode Island Kids Count fact book that had about 22 indicators in it to this past year's book that had 71. Mm-hmm. And that's because each year the organization says to its partners what's missing. And I can't overstate the importance of having that foundation, because it wasn't just getting as much data as we could get our hands on. It was being very strategic about what are the key indicators that really paint a picture of how kids and families are doing, number one. And number two, having consistent data so we could measure trends over time. So the child welfare section of the fact book is within the safety area of the fact book. And there's about 5 or 6 really key indicators: out-of-home placements, the overall numbers of kids in the child welfare system, a lot of information on kids aging out, kids waiting for adoption. The organization keeps track of young people aging out, and most importantly, outcomes. How long does it take for permanency in the average case in Rhode Island? How does that compare to other states? So it's been a firm foundation, and it's grown since the organization started. And I'm pleased that working with the data staff at DCYF, there is a lot of cooperation about getting numbers in time for the fact book publication, and that many people who are on the front lines, both staff and other providers of services within the DCYF system, have said how important it is to really have that data reliably released each year so that we can really measure how the state is doing.
Right. Some of the indicators that you mentioned were sort of post or DCUF involvement, right? And I've worked in both Massachusetts and Rhode Island in the child welfare world, and there's definitely a noticeable shift towards prevention. So what sorts of indicators do you think are most important? You mentioned housing, you mentioned sort of economic well-being and stuff like that. What sort of the biggest indicators you think for strengthening families in terms of preventing child abuse and neglect so that they can avoid involvement in the child welfare system to begin with? And you also mentioned people are always asking for what's missing. So, and that kind of took a question away from me in a way. I'm curious to know if you think there are things that are still missing, but I'm also curious to know if you think that there are sets of data that need to continue to be enhanced and more robust.
Absolutely. There's always ways to do better with data. It's changing all the time. When I look at the word prevention, I really think about big systems that sometimes sit in silos. So people look at child welfare in a silo sometimes, education, safety, economic well-being. I mentioned housing as a key part of economic well-being. And overall, I think that prevention of involvement with the DCYF system has a lot to do with the economic well-being of families. and the economic well-being of families has to do with having access to an excellent public education system so that people who are forming families have access to the kind of education and training they need to lift their families out of poverty and have many more opportunities for higher quality of life in terms of housing and all of the other things that go with it. So I think we have a big job in Rhode Island to try to urgently bring up our education system in terms of preparing kids for either careers in the trades or college, having opportunities for high-paying jobs. And that's everybody's responsibility to do that. Community partners, the schools themselves, our political leadership. That has been something that is one of the biggest prevention areas, I think, is high-quality public education starting in the earliest years. Rhode Island has made great progress with expanding access to public pre-K. It is doing more to provide resources to early childhood educators, including childcare providers. And I think that's an area where all the way from birth through college, there are things that we can continue to do. But progress is being made. I was just reading about some of the successes of Prepare Rhode Island, where young people have the opportunity for internships during their school years to really make them much more shovel-ready for jobs in the real world. So I think that all of these systems working together is what really is going to make prevention materialize in a bigger way than it is now. So it starts well before involvement with the child welfare system. Once we're into the child welfare system, I think having a family and community focus, and that's been a lot of emphasis on the part of DCYF in recent years, and trying to get in early to, if there are behavioral health issues, for example, trying to get care to family members, kids, and their parents before behavioral or mental health issue escalates to the point of needing DCYF intervention. DCYF, I should point out, is also the Children's Behavioral Health Authority in the state, and so it has statutory responsibility for both children's behavioral health, including children who are not in the child welfare system. And some people think that they're two separate things, but it's the same agency.
Mm-hmm, mm-hmm. Yeah. What is it that you would want to share with both new and existing child welfare staff about the importance of data and child welfare? And I think the bigger question too sometimes is, what do you say to that frontline child welfare worker that's dealing with all these sorts of systems, and they say, I could imagine maybe someone saying, yep, we definitely need better education. Yep, we definitely need more housing. But you know what? I've been working with the same parent and they just cannot seem to get over their substance use or mental health challenge, right? So what is your, for lack of a better word, advice, I guess, or directive or strategy that you would want to give to them to say, yeah, I know you are fighting an uphill battle. Like, there's long wait times for certain services. There's a lack of certain services when it comes to behavioral health. We know this is a big issue. You might have someone say you could have the best education in the world, but if mom or dad is really struggling with their own mental health and they can't get their kid to school or something like that, or the child themselves is just really struggling with their mental health and they can't get to school, then we're not meeting that threshold, right? So what are your sort of thoughts around that in terms of what would you say to that frontline worker?
The first thing I would say is that I have so much respect for the hard work that our frontline workers at DCYF and some of the agencies that are out there on the direct service lines as well. But frontline workers at DCYF have an incredibly hard job to do. And I have not walked in their shoes. I respect them so much for stepping up to this work of being there for children, protecting children, working with families, trying to maneuver around all of the barriers that you just mentioned, Stan, that they have to see every single day. So I just want to say how much I respect their work and how important it is to be sure they have the support to do their best work. And so the more we can sort of work at both at the same time of supporting people who are on the front lines with some of the most vulnerable children in the state. At the same time, at a more systems level, we're working on some of the issues we've already talked about. I think that we need to look at what the supply and demand issues are for things like substance use and behavioral health, access to behavioral health. If there are, as we know, there are barriers to getting care when you need it in the right dosage and for the length of time that you need it, it's really not going to help. So I think there have been more opportunities to come to the table and say what's working, what's not working. And I think that we just have to absolutely continue to commit as a state to making sure that people who, especially people who are reaching out and need treatment or need behavioral health services, get them. Just in the past legislative session, there was progress made on the Children's Mobile Response Stabilization Services, where if a principal calls that hotline, a child-trained team will be dispatched to stabilize the child, connect with their family, and get that child enrolled in community-based behavioral health services, which is so much better than having a principal with the two other options that they used to have, which is one, call the police, which gets kids involved in the juvenile justice system, disproportionately kids of color, but all kids that need specific behavioral health help that is not a call to the police department, or getting an ambulance to take them to the emergency room at Bradley. So I think that there are things like that that are starting to help in that behavioral health area. There's the new CCBHCs, the Certified Community Behavioral Health agencies that have been set up in Rhode Island. But there's still more to do, just because the Kids Count Factbook reports that the 1 in 5 children or young people in Rhode Island have a behavioral health issue, but only less than a quarter get treatment for it. So,
and what is the quality of that treatment too, I think, is another question that I would have, right? Like, are they getting adequate care? Are they getting adequate treatment, quality treatment, right?
Right.
Yeah. So this is sort of your kind of abbreviated opportunity to do a training for DCYF staff. We offer training on an ongoing basis, right? So, but if you had, let's say you had 2 or 3 hours, you were going to, have a bunch of DCYF staff in the room, what would be your biggest priorities that you would want to talk to them about, especially when it comes to just your overall experience, but just, again, like the importance of data? What do they need to know? What do you think that they need to be cognizant of? What are some of the big disparities that are happening right now when it comes to any of the topics that we've kind of touched on already? Like, what would you be prioritizing if you had that? If you had the floor with them for a couple hours, what do you want them to know?
Well, again, first I'd salute their work. Mm-hmm. And then I would say that data, both qualitative data, the stories and the experiences that really paint a picture of what families are dealing with, what kids are dealing with, what their own peers are dealing with in service to kids through DCYF, as well as the quantitative, the numbers. I think that there's a lot of misconceptions out there about how many kids does the department serve, what's the sort of the linear kind of line from the hotline calls and how many hotline calls DCYF gets per year, mm-hmm. to the number of cases that are opened, to the number of cases that are indicated, to sort of the final results, how many kids of all of those hotline calls are removed, how many are united with their families or possibly with a kinship foster care parent. I think that sort of basic data would be a great thing to have, and I know that the department probably does a lot of that already, but I think as a framework of both qualitative and quantitative data. Also, knowing and understanding the continuum of services that are there, and it doesn't help people in their position to just have a laundry list of services. They need to know what behavioral health services are there, what have open slots, how do you get a person referred, how do you follow up and be sure that the services have been used, or a family that's experiencing food insecurity, what resources are available for that. Health coverage is key, and many families qualify for the Right Care program. Some may not know it. Fortunately, we have about 96% of our kids covered right now, but that's the gateway to a lot of these services. So training on Right Care, I think, would be a really important thing so that they can help refer families who are uninsured to health insurance coverage. I think another thing is that, and it's kind of just used a lot, about the whole child and family. Obviously, children exist in their families, and so as solutions are being looked at, I think that an emphasis is what are the supports that may not be directly immediate family, but in the family and in their friendship circles, teachers, others that are resources in terms of helping that child as things go ahead. So all of those things, I think, are part of just trying to know what in the slim resources that are out there, what are readily available. And I think there's also been some additional emphasis on building effective partnerships with young people who have experienced foster care. I think they can be a really important resource for people entering this field about how they have experienced the system. The Annie E. Casey Foundation has a new free curriculum that might be a good resource called Elevating Youth Engagement in the child welfare system and especially in the foster care system. So I think all of those things, and also like sharing success stories. No one can come to work every day feeling like it's all bad news. It's all stories of failure and real difficult circumstances for kids. And I think some of the success stories that some of the youth themselves can share later on when they've gotten the right supports and services to succeed. I'm inspired every time there's a group of young people who've experienced foster care that come to the State House and tell their stories, because I think their voices can actually give some specific suggestions for what would have made their journey easier.
Right. Yeah. Talk about good qualitative data, right? You know, hearing the lived experience from someone that has gone through the system and gone through those experiences, right? I think is so key. But I heard, you know, paying attention to the data, helping to collect the data. I think I also heard you kind of said that I really liked the piece around helping to understand that there's a lot of work that goes on behind the scenes to try to prevent the worst case scenario, right? Like a lot of calls that come in and there's just a lot of triaging that happens, right? And there's a lot of, I think that's good for a new worker, especially to know that like they will learn that as their part, they go through their training program and stuff like that, kind of the different processes, right? But I think not just the community, but for someone that's coming in new to really understand, like, we're not just going from A to Z and, you know, 0 to 60 is just like that. We're just removing kids left and right. We're really trying to avoid worst case scenarios and that kind. So I appreciate that, and I think that there could definitely be better public awareness raising around like kind of all the work that goes on behind the scenes, right? In terms of trying to, if you know, something comes to the attention of the child welfare system, there's a lot of stuff that happens to try to prevent the worst case scenario from happening. We want to try to keep that family together. We want to try to put a safety plan in place. We want to try to do all these other things we can in order to try to prevent the worst case scenario, right?
Yeah, and there's something called the SAFE model that DCYF adopted that really has that kind of continuum in mind. It takes the whole family approach and it sort of looks at everything that you've just said. So that it's comprehensive.
Right. So you had a lot of policy achievements in your career and very impressive policy achievements in your career. What has helped inform your decision-making on prioritizing those policies, and what do you feel the biggest policy gaps affecting kids and families in Rhode Island today?
Well, I would say We've already talked about one of them, safe, affordable housing. That's a policy gap. We've talked about another one, which is the need to improve our education system and give all kids access to the best high quality public education, leading to career opportunities and college if they want to proceed with college. There's also, I think, an opportunity on children's behavioral health and family behavioral health, that we have a lot of good pieces that are coming together, but we still aren't meeting the demand. And a policy opportunity, it seems to me, is integrating behavioral health into primary pediatric care and primary care for adults, including OBGYN. The brain is a part of the body, and we are slow to the game, not just in Rhode Island, but in the country, in really integrating behavioral health as part of your physical health and as part of your regular primary care visits. The Hassenfeld Institute has been working on that. So that's a policy opportunity that we're within reach of. And finally, I would say it's that we give lip service to a continuum of care, a coordinated continuum of care. I think we need to think about some flexible resources that can be used to support families in their homes and in their communities, because sometimes things happen that require some assistance. It was called the Family Care Community Partnerships, the FCCPs, had some flexible resources. They would work in partnership with DCYF in regions, and instead of always having dollars assigned to specific services, sometimes the flexibility was really important to just get a family over a more short-term situation. So I think that sort of community focus is another policy opportunity. And finally, realizing that, as I've said before, people who are in the front lines of this work need to be supported. It is a hard job. It is a very trying job to be on the front lines. And so for both people in the service of DCYF and their community partners, we need to look at how to support them in terms of supporting the workforce by having pay for our workers that can compete with other much less trying jobs, and also hold everyone, all parts of the system, accountable for outcomes and learning what works in order to give more and more kids a chance. And I think that's just a huge, obviously, area. But I think that what I've found over my years is that being strategic about pieces of the system that together can have an impact are where we are today in the child welfare system. There's much more of a recognition that you really need to be concerned about educational outcomes for kids in the care of DCYF, that these aren't separate silos, but they are all about giving a young person or a child a brighter future. And so I think some of the recent work that has been really looking at educational outcomes has been really important. And partnerships, not just an agency working in a silo, but partnerships across agencies are key too.
Yeah. Yeah, you mentioned the sort of mental physical health connection, and I think there's a lot of stuff out there, but you've got to kind of go out. You've got to be intentional. You've got to go out and find that stuff for yourself. And I think that the suggestion you have around like the more integration with your own primary care provider, pediatricians, and bridging those gaps will make it easier for people and more accessible for people to understand, how their mental and physical health do connect. I think is key, because I think there's a lot of stuff out there, but you've got to kind of go out and find it, and you've got to know what it is you're looking for sometimes, and go out and then be intentional about trying to find some of that stuff. But again, just to kind of like go back and maybe just sort of tie things up, right? Because I think as you were talking, there's some tie-ins to some other upcoming episodes that we'll have. One being on the correlation between poverty and child abuse, child maltreatment, and the other one that actually we'll be recording next week where we're going to be meeting with a couple of neuroscience professors to talk about how the brain responds to stress and chronic stress, particularly in the workforce, right? So, but I'm curious again, just to kind of tie things together. how did you prioritize things in the past, and how would you maybe prioritize things now? If you were still in the kids count chair, so to speak, how would you be looking at prioritizing different policy initiatives, bridging some of these gaps, filling in some of these gaps in services and stuff like that? How would you be looking at the landscape?
Well, it's a great question. And what I said then, I still say now, which is that, and Kids Count still says now, is that the number one indicator of all the indicators that we measure is childhood poverty, because poverty makes a difference to every other thing that Rhode Island Kids Count measures, from health to education to safety. All is very much connected to a child's economic stability. And so there is no question that people of all income levels get involved with the system, but that a greater proportion of children in the DCYF system are children from low-income families. But I think it's really important to talk about that in a way that makes it very clear that increasing economic security for our families is something that will definitely have an impact on our DCYF caseload. And it's also very important to say there are so many families living in poverty who have no involvement with the DCYF, who are stupendous parents. So any of these broad generalizations, I think you have to be really careful of. But poverty in general really limits a child's ability to thrive in all of these areas that we care about. So I think it's really important that you have some upcoming segments of this podcast to dive more deeply into that issue. And one of the things I wanted to say to help sum up is that having been involved with policy change for such a long time in Rhode Island, I think one of the things that we should focus on is that when we talk about our system of care for kids and families, it has to be well-resourced, have a governance structure and system design, so regardless of leadership changes, the system has a solid foundation. Because one of the things with work that's so hard already is going down a road and making progress, and then there might be a leadership change and a different emphasis. So I think having people sort of come together for the long view and really trying to build for the long term a seamless system of care that starts early, emphasizes prevention, provides the flexibility for services and supports to be given to families on the early side, will help to reduce the caseload at DCYF and improve child outcomes.
Right. Yeah. Elizabeth, thank you so much. Any final thoughts?
No, just that it's been great to be here, and thank you for putting these issues out there and for all you do.
Thank you. Appreciate it.